So we have a pill that was sold as a harmless treatment for morning sickness, but it caused a global tragedy and rewrote the rules for drug safety. I'm Matt Hasquin. I'm a high school history teacher, and I'm taking you line by line through Billy Joel's We Didn't Start the Fire. We are moving on to Children of Thalidomide. And when Billy Joel sings of Children of Thalidomide, he's pointing to the late 1950s medical disaster that transformed how medicines are tested and labeled and approved. The drug at the center was thalidomide and was introduced in West Germany in 1957 as a sedative that also eased morning sickness. It spread quickly across Europe, Australia, Canada, and parts of Asia under various brand names. Doctors were told it was so safe you could not overdose, and companies marketed it to pregnant women without adequate testing for pregnancy risks. In late 1961, pediatricians and obstetricians began connecting a surge of rare limb differences and other severe birth defects to mothers who had taken the drug early in pregnancy. Pharmacies withdrew it country by country. Regulators caught up only after the harm had already been done. Numbers were pretty grim. Rough estimates suggest about 10,000 babies worldwide were affected. Many died before or shortly after birth, and survivors often faced lifelong challenges involving arms and legs, ears and eyes, and internal organs. Families suddenly needed prosthetics, surgeries, and accessible schooling that did not yet exist. Parents became advocates overnight, demanding recognition and compensation. The United States is a special chapter. Thalidomide was never widely approved for general use there because an FDA medical officer, Dr. Francis Oldham Kelsey, refused to sign off without stronger safety data. Samples circulated in small investigational contexts, but her insistence on proof spared the country a disaster on Europe's scale and made her a national example of why cautious regulation matters. The policy changed fast. In 1962, the United States passed the Kefauver-Harris Amendments, requiring drug makers to prove effectiveness as well as safety, to disclose side effects, to secure informed consent during trials, and to tighten manufacturing standards. Other nations toughened their review processes too. The modern checklist, preclinical testing, controlled trials, pregnancy warnings, post-market surveillance, all of these grew out of the crisis. The story did not end with withdrawal, though. Survivors organized for decades. They pushed for apologies, settlements, and ongoing support as medical needs and costs rose with age. The drug itself returned later under strict controls in specific contexts. Usually these were paired with prevention programs to prevent another tragedy, though. The teratogenic danger never really went away. Our systems for managing it had to basically grow up. So why is this line in the song? Well, because it captures a moment when trust in labels and ads collided with the realities of biology, and when grief forced governments to make evidence the centerpiece of medicine. With just these words, the children of thalidomide, Billy Joel names the children whose lives reshaped the rules, proof that public health is written in policies after it's written in people. The reason why it matters, well, thalidomide explains why regulatory skepticism saves lives and why patient voices matter. It's the origin story for modern drug trials and warning labels and the idea that pregnancy risk must be tested and not just assumed. If you enjoyed this episode, Children of Thalidomide, please leave a like, a comment, or a share, or something along those lines. Anything's great. And I'm going to go ahead and keep moving our way through the song because we're going to move on from Children of Thalidomide to Buddy Holly. Thanks for watching.